Welcome to the IT Woodworker Podcast, where we discuss business and IT topics. I also include a woodworking project every once in a while, which is something that helps me keep my sanity in this fast-paced business we work in. If you enjoy the podcast, please like it, subscribe to it, and share it with your friends and colleagues. Thanks, and I hope you enjoy.
The measure of society is how it treats the weakest members. That's a quote from Thomas Jefferson. That quote really embodies the content of our podcast today. I'm Chris Kousoulas, host of the IT Woodworker, and I have a special guest on today, Zach Swingen. He is the lead GIS coordinator at Milwaukee County Office of Emergency Management. Zach, welcome. How you doing?
I'm doing well. Thank you for having me, Chris. How are you doing?
I'm doing great. I'm excited to start this conversation off here. Before we jump into it, though, could you just give us a little bit of background on you, kind of how you got into IT? Starting at Milwaukee County. How long you've been at Milwaukee County, those kind of things.
Sure. So I always, for as long as I could remember, wanted a career in public safety. So I went to school at UW-Madison and majored in political science, sociology, and criminal justice. And that eventually took me to a job as a correctional officer. But after 3 years of doing that, I figured out that the nights and the weekends and the holidays, I didn't want to be working those.
Mm-hmm.
So I set out to find a career that would allow me to make a big impact in the public safety world, but still kind of live that 9 to 5 lifestyle.
Okay.
And yeah, I had a couple of friends who went through the UW-Madison GIS Capstone Certificate Program. And it's a program that took people with no geography background, but a bachelor's degree, and kind of put them on a fast track to learn GIS and be able to start their careers once they're completed. And while I was there, I did an internship with the state's emergency management agency. And as soon as I had wrapped up that program, within a couple of months, I was at Milwaukee County in the Office of Emergency Management, where I've now been working for about almost 5 years now.
Okay. Excellent. Well, that's kind of, so you didn't think you were going to get into any sort of IT before you were going to get into the public service. And
Chris, I growing up, I thought I never want to sit behind a desk, but after 3 years working in the correctional system, I was just like, somebody get me a desk.
Gotcha. So, okay, great. That's some good background. And as we dive in a little bit deeper and talk about the content today, could you just explain what GIS is? I'm not sure, and I think I understand it as kind of a high level, but just kind of get in so people know what GIS stands for and what you guys do from a GIS standpoint.
Sure. GIS stands for Geographic Information Systems. And I always think of it as the branch of the data science tree that deals with where. That we all know the who, what, when, why, how. We deal with the where. So it's the concepts, the methods, and technologies that utilize location data. So my role has a lot of overlap with folks in other forms of data analysis, with the emphasis that we're using data to inform decision making, with kind of a big distinction of how we can present that visually. Whereas a lot of data analytics relies on charts and graphs, we get to express our artistic side with the creation of maps, which always make for some very cool and impactful visuals.
Sure. Okay, good. Well, thank you for that. And why don't we start to jump right into the content here? And that starting off with that quote that I started off with, Thomas Jefferson. Zach was instrumental during COVID in creating, I believe it's a COVID dashboard for the county. Maybe I'm getting a little bit too far into this right out of the box, Zach, but what the COVID dashboard did was allow the county, Milwaukee County, to really look at the outbreak of COVID, where the positive testing was going on, where testing was going on, and then where vaccinations were going on. And then through this data, you guys were really able to to go after the highest vulnerability population and make sure that they were vaccinated. So that's like a really high level of kind of what the conversation was. But from a starting point, is that a good starting point to talk about that?
Yeah, I think you did a great job introducing that, Chris.
Okay, good. And you have the EVE model, and that was something that I was kind of looking at, and that's evaluating vulnerability and equity. Did you want to just kind of jump in and well, maybe we should talk about the beginning when COVID started coming out, and why this was important, and who came to you and talked to you about it, and how you developed this. So I'll kind of stop right there and let you. I mean, I threw a whole bunch of things at you, Zach, but I know you can handle them. So
I appreciate it. I like a good tangent here and there, so you might have to stop me if I start going off on different directions.
No problem. No problem.
But so most counties and most local governments have their own land information office, so their GIS staff is focused in a particular department. Sometimes directly under IT, sometimes their own separate area that usually handle a lot of the GIS work, a lot of the location services like maintaining parcel data, creating maps for all other departments in there. And Milwaukee County, we have an outstanding land information office that, does an incredible job managing our spatial data. But within a few of our different divisions and departments, we have some kind of in-house GIS council is how I like to think of us, as kind of like, that the GIS intensive departments like our parks department and our office of emergency management, we rely on GIS so much. We thought like, hey, let's get our own folks in here. And all that is to say, we don't have a public health department countywide in Milwaukee County, but we do have our EMS system housed within the Office of Emergency Management. So once the pandemic hit, we didn't have that traditional infrastructure of a county public health department, which this would normally go. And instead, all of our data sharing agreements were with the Office of Emergency Management. Chris, this is probably going into way farther.
No, this is perfect. This is perfect. We need an understanding. Go.
So yeah, we just kind of found ourselves in a very unique position where we had access to the data and we had skilled subject matter experts with data analytics, as well as the public health side of things, all in this department, the Office of Emergency Management, that we were able to kind of really get things going off the ground pretty quickly here. And just for kind of like a brief idea of the timeline, I believe we had our first reported case in Milwaukee County on March 13th of 2020. Mm-hmm. Which was a Friday. I remember it being Friday the 13th. We were all told to pack up and head home. And our initial COVID dashboard, launched on March 19th of 2020. So that was the following Thursday. We were able to have things up and running. And
6 days.
6 days. Normally I know you come from a tech background. Normally the turnaround is
4 to 6 weeks, months, years. Yeah. And then we keep pushing out. We can't get equipment in, so it's gonna be a little bit longer.
Right. You want to build a sustainable infrastructure when you have the time to think and plan it out. But here we were facing a real emergency, so we kind of had to build the plane as we were flying it, and that immediately looked like we wanted to track cases, hospitalizations, deaths, and other data right away, to inform our public and to also shape the decision making for our local leadership. Mm-hmm. And it was pretty soon after we had launched that, we had noticed some systemic health inequity. Well, we noticed some disparities within the data that we wanted to put front and center on our dashboard. So our leadership at the county decided to move our statistics on the race and ethnicity of those, hospitalized or infected or who had died from COVID. We wanted to move that to the front to really steer that conversation. And Milwaukee has a long history of being one of the most segregated cities in America, if not the most segregated cities in America.
Mhm.
And systemic health inequities are something that have really been on the forefront of everyone's minds here within the county since about May of 2019, when our then county executive declared racism as a public health crisis. So when we really start talking about COVID and our dashboard, I like to think it all kind of stems from that declaration in 2019 that led to resources being spent towards addressing systemic health inequities here at Milwaukee County. And that came through a variety of different things. Like we had an Office of African American Affairs was created, which is now the Office of Equity. There was a racial equity ambassador program created, as well as racial equity training being delivered to all of the 6,000 some county employees. So back in 2019, we were putting the steps in place by the time COVID hit to really address this phenomenon head on.
And I'm going to put a link to the GIS, to this dashboard that you guys have created in the notes so people can look at it. But I've got it up on my screen here, and it's pretty cool to look at. And you almost built like under the Eve model tab. If you look into that, it's like I don't know a better way to say it, but maybe like the magic quadrant. So, and then, part of it that you were looking at in there was it was high vulnerability, high vaccination rate, and that was green. And there's different parts in the city, but you're right, it's pretty segregated. And then there was a high vulnerability rate, low vaccination area, which was orange. And you and I had talked about this before, but having built that model, you were able to take resources and say, hey, we know this area is well vaccinated. They might be high vulnerability, but they're well vaccinated. This area is high vulnerability and they're low vaccinated. So you're able to move those resources around to really help out, the weakest population. I mean, that's pretty cool. It's pretty powerful stuff you guys did.
I'm so excited to be a part of this team and just have the opportunity to work on this project, and especially in an organization that really does want to put data as well as race and ethnicity at the front and center of decision making. We want to do what we can to dismantle systemic racism, and wherever and all possible, use data to help drive decisions on how to do that.
Mm-hmm. And I know we talked about it before, if you had any kind of statistics on what moving these resources around did, and you'd said, you guys really hadn't dug into that, but I have to imagine it made a huge impact. It had to make a huge impact.
So if you don't mind me talking a little bit about the Eve model, Chris, I can kind of jump in.
Go.
Since the COVID dashboard launched in March of 2020, we had a lot of iterations, a lot of things added and taken away, kind of as we learned what the important metrics to be looking out for. So we had it evolved very quickly, and a lot of times you're running as fast as you can just to stay in place. But once vaccines began to roll out around December of 2020, we noticed that there was an opportunity to kind of get ahead of this. Like, we didn't have any warning. Well, we couldn't foresee the impact of COVID ourselves, but we did realize how important vaccination was. So this was really one of the first times we had that opportunity to plan something out ahead of time and really pour as much, a lot of thought and resources into this. So I think we started working on the Eve model around December or January of 2020, 2021. And we initially had to wait a little while before we could get data agreements in place in order to get that vaccination data. So while we had that time, that allowed us to really, really flesh out what we wanted to see and how we wanted this tool to be used. And from there, we kind of considered high vaccination, or the vaccination rates, to be, of course, an important factor. But we also wanted to take vulnerability into account. So that's kind of our our process of building equity into this project was looking at the CDC's Social Vulnerability Index, which takes many different variables and many different groupings to identify the most vulnerable populations within a given community. And it's a pretty amazing tool that has a lot of wide uses, especially during times. I think they might have even said, like, in case of health emergencies, like, please use this tool in there. So yes, I know you mentioned the quadrants before, but we were looking at we want to look at vaccination rate as compared to social vulnerability and really identify where is the low vaccination and high vulnerability. Those are the areas that we really want to start impacting, and we could do that in a variety of different ways. And one of the first ways was opening a zip code program for the 10 most vulnerable zip codes within Milwaukee County, and opening up vaccinations to residents of that zip code. And this is going back to a time when there were different tiers systems of who could get vaccinated. And this was kind of like, hey, we're gonna put that tier system aside for residents of this zip code, and make sure that those who need this the most have access to it. And the way that actually came about is, we were sitting around drawing out different ways of how we could approach this problem. And once we finally got the data, we had everything in place. We were ready to just plug the data in. And once we plugged that vaccination data in, we took it to our now county executive, David Crowley. And he, I think immediately within that night, within a few hours, was speaking to the state of Wisconsin and saying, hey, we've got something going on here. And yeah, within a couple of days, the zip code program was up and running because everyone, all of our leaders realized this is an issue that we cannot ignore. And this is something we need to do something about. And I think that's also, I'm a huge fan of GIS, obviously. Like I'm pretty heavily biased in that. Sure. So take it with a grain of salt, but I do say that map really does communicate an argument and a story within the half a second that your brain takes to process it. Like, we could be writing 40-page reports until we were blue in the face, but I think that map really helped convince our leaders, and it makes it clear. It makes those decisions like very easy for them, seeing that laid out in that visual manner.
Data is really powerful, and when you can show them the data, I mean, like you said, creating real cool maps, it's really easy to read. It's really easy to interpret. And when you can show them that, hey, this is where it's needed, this is where they're the most vulnerable, it's easy to shift those resources around. I mean, what an incredible tool. I started this podcast to talk about, IT and just some cool IT things. And you guys really, I mean, kudos. You did a really great job. And has this been used for, because I know that the vulnerable groups out there, they don't always go in for health screenings. They don't always go in for regular procedures, which can there's cancers out there that if they're detected early, it's pretty simple. Well, I shouldn't say simple. It's a procedure that can go successfully at a very high percentage. So I would imagine if a model like this could be used to do that same thing and maybe send folks out or something, or try to get those folks into the healthcare system, you could increase population health. Has that been something that's been addressed at all?
Yeah, definitely. We're looking at many different ways that we can use this model and use vulnerability when we talk about health outcomes. And within the Milwaukee County Office of Emergency Management is our Emergency Medical Services Division, which has a huge wealth of data available to them about encounters within the EMS system. And right now we are really working towards, and this is in concert with a lot of our partners at Milwaukee County, especially our Information Management Services Division. So that's our IMSD, our IT department, just by another name. We're looking at housing data from all from a wide variety of different sources into a structure where we can easily access it and plug it into dashboards and maps and products that can be used in the future, so that we kind of don't get caught on our heels with the COVID data like we did. It's the COVID data, came in a spreadsheet, a couple of times a day during the beginning of the pandemic, and it took a long time to maintain that reporting and then also build out the infrastructure behind it. So right now we are working on a lot of very interesting projects that are going to rely on the lessons that we had learned, and build that infrastructure out so that we can maintain this long term.
Was this really kind of a grassroots thing, or were there other organizations that you were able to lean on and say, hey, this is what we're trying to do, what are you guys doing? Or did you guys just really say we're developing it from scratch?
We're always open to collaborating with other organizations, and I know the John Hopkins dashboard was a huge influence on what we were able to accomplish. And we also had the tremendous benefit of having Dr. Ben Weston, who is now the Chief Health Policy Advisor for Milwaukee County.
Okay.
He was with this very small team working on the dashboard since day one, and to be able to have a public health domain expert, immediately within your team, just an invaluable resource. And I do want to plug that out there. To all the other organizations that have GIS and data folks, when you can really get everyone in the same room working together, people from different domain expertises, interfacing a lot, working on things in a collaborative environment, you can really get some amazing results.
Mm-hmm. Yeah, you guys are proof of that. So very cool, very cool. So I appreciate this. And just in full disclosure to the listeners too, Milwaukee County and OneNeck are partners. We provide hosting and managed services for the Milwaukee County organization. So just wanted to throw that out there too. I'm very pleased that Zach was able to come on the podcast today and talk about this. Any kind of parting words before we take a little break here, Zach, that you wanted to throw out, or any little nuggets of information?
I definitely want to I gave a shout out to Dr. Ben Weston, and we have an incredible team here at Milwaukee County, including our data analytics manager, Shannon Grauman at OEM, who is now working for our information management services division. We had the expertise of our EMS division director, Dan Pojar. A huge partnership was with our land information office. And they're the folks who build the databases and populate them. Want to shout out to Lee Frederick, who without his expertise, without those partnerships, we wouldn't have been able to automate this. This would have been us kind of working still off as CSVs for the longest time. Yeah. And then also to our IMSD department. Just gotta give a little shout out and a plug to the true hard workers here.
Excellent. Well, thanks, Zach. Let's take a little break here, and then we'll come right back and wrap up. Hey, welcome back. So here we're gonna kind of wrap the show up, but I thought it might be a good idea for Zach just to talk through a couple more GIS projects that he's working on to give the listeners just maybe a little bit more of an understanding about what he does and what those projects are.
Thanks, Chris. We've got some very exciting projects going on. We're able to build off the momentum of the work that we've done over the past few years. And for instance, coming from an emergency management perspective, we are also looking to build equity into that space as well. So just kind of a typical example of what you might find in another GIS project, or maybe a different way of thinking about things, is that when a disaster strikes, it's pretty important for everyone to get an idea of the damage as soon as you can, and specifically the level of damage, the severity, but also the dollar amounts have a big impact on potential federal funding. So the state of Wisconsin has kind of worked within FEMA's development guidelines to create an app where if someone in emergency management went door to door after a significant flooding event or a storm, they could record that damage on their phone with that location. And that's now all available as a layer that's hosted in the cloud. It's living online. And we can even see that layer of points within that data layer and get that location. So something we've been working on is how to, show that visualization, but also through a lens of equity and vulnerability. So we've currently been working on, consuming that survey that's coming in, presenting it on a map for our local leaders with our nice little tallies of, hey, this is how much damage we've observed. These are the types of damage, but also having an underlying layer from the social vulnerability index.
Mhm.
Here I go mentioning it again, where you're able to select those layers and only identify the sites that occur within our most vulnerable areas. So a lot of times, like in a project, if you're just creating something for a one-off end result, you can like bake that information into every record in that row. But this is a pretty interesting way of looking at real data that's filtering in real time and being able to assess that by vulnerability. And that's something that we're really, really excited to move forward on. And Chris, do you mind if I talk about some other examples?
No, please do. This is exciting. I like this. This is
Okay.
why I've got this podcast talk about the cool things that technology can do.
Can I hit you with something a little less serious?
Sure.
All right. So one of the ways that GIS was introduced to me was through site selection. So Chris, say you come to me and you say, Zach, I want to build a brewery. I want to build and own and operate my own brewery.
I like the sound of this.
Yeah, how do we go about doing that? So depending on your level of domain expertise, we can get together and figure out, like, okay, what are the things that you're looking for that would be vital for having a successful brewery? And we might talk about being within a half-mile range of a main transportation highway, something like that. You got to be able to get whatever you need in and then get your product out. You may also say, Zach, I love hoppy beers. Hoppy beers are my passion. I don't know if that's true or not, but
I do not like IPAs.
do not like no IPAs. We're going for something different.
In a pinch, I'll drink one, but I'm not a big fan.
So you're going for a fine Pilsner.
There we go. There we go.
And you say, I want to make Pilsners. I notice that there's certain market demographics for people who drink Pilsners. Like I want to target, men age 30 to 50 who make a certain level of income for whatever reason. Those are the guys who love Pilsners. Can we figure out how to make this brewery accessible to them? Or maybe it's within a certain radius of their neighborhood, because they're not going to want to drive 20 miles down the road to come stop by the tap room. And then perhaps you're also looking at space. So you say, I want to look at different sites that are available for purchase that have enough room for all my equipment. And what we would then do is, once we kind of figured out, hey, this is what you need to have a successful brewery, we go out, I'll find those different data layers. We can get the roads and center lines from many lovely local land information offices, provide some great data there that's publicly available. We can go to the US Census Bureau to get those demographic data to really capture your audience and who you're looking to bring into your tap room. And then we can also look at a layer of vacant sites that meet your needs. And what we do in GIS is stack all those layers on top of them and create a nice map for you. At the end of the day, you can sit back and look, I should build my brewery here, here, or here, and maybe go through and add a few more constraints and look at the price tags on those buildings at the end of the day too. So that's kind of how GIS was introduced to me.
So I didn't even know that was, I know it by looking at taxes and looking at my plot where I live, but so is that something that all big cities do, where I mean, you can come to the city and say, hey, I want to open up a data center. I need to have plenty of power coming in. I need to have plenty of water coming in. I need to be this big of a building. And you guys will come back and say, these are the locations within the city based on, your requirements to fit your needs.
Yeah, I would say that's a big part of the GIS analysis job.
Mhm.
That analysis work is whether you have somebody within your organization who uses GIS, like they're going to be able to do that for you. If you own a company like I think McDonald's and Starbucks don't just throw a dart on a board to figure it out. They have their staff to be able to do that. And I know a lot of governments rely on GIS to make those decisions around that question of where. And we're trying to use that as much as possible here in Milwaukee County.
Well, listeners, if you want to move to Milwaukee and you know exactly what you want, reach out to the GIS department and they're going to hook you up with some good locations.
I might direct you towards somebody who's set up their private business to help you answer those questions. But
well, excellent. This has been a really educational for me, and it's really exciting. It's great to see when you can use technology to do such good things for the society and increase population health. So I look forward to having you back, Zach. So This was great, and thanks again. I appreciate it. Have a great afternoon.
Thank you so much. Take care, Chris.
We'll see you.